So again, and this segues right into this slide, time-restricted eating and intermittent fasting is a great way to manage your intake or how much food comes in and portion control. So this is temporal portion control. We've talked about mechanical portion control. We talked about chemical portion control. Now we're talking about temporal portion control. If you limit the number of hours that you're allowed to eat per day, you will never be able to eat as much as you normally would. Most Americans eat 16 hours a day, and if you're not eating, you're asleep, which is not really natural. Time-restricted eating shuts that down. So you might have a 10-hour feeding window and a 14-hour fasting window, 12-12, 8-16, so on and so forth. The key to this diet is it's not really a diet. It's more that it's giving your body the normal fasting feeding cycle that it needs for that fight against entropy that we talked about in the beginning, the second law of thermodynamics. The only way your body can repair and fight the disorder that is natural, the protein breakdown, the lipid membrane breakdown, the DNA breakdown, is to have a repair cycle, and that is the fasting cycle. So if you want to prevent arthritis, prevent pain, prevent stiffness, you have to give your body a repair cycle, a maintenance time frame every single day. And that's why time-restricted eating is super duper helpful, and it helps your brain. And then once you get on a time-restricted schedule, all of the hormonal signals and the neural inputs to your brain change with you over time, and you stop craving food all the time. You really only get hungry when your window opens, and then you are totally full, or you have massive satiety when the window closes. It just becomes a natural way of being. Intermittent fasting is a little bit different. The terms are interchangeable oftentimes. Intermittent fasting is like literally not eating for a day or more, and then eating on the other days of the week. I don't really like that plan because I'm a big believer in the circadian rhythm too, and I want eating to match the circadian rhythm. And if you don't eat for a whole day, that does not match this dark light cycle. Studies are ongoing. People are looking at this very heavily right now, but I'm a big fan of time-restricted eating and try to get my patients trying to lose weight on this because it just takes all that mental effort of weight, like thinking about food, off the table. So it's even been shown if you still eat a crappy, terrible, ultra-processed diet, but you limit the number of hours you eat it, you still are healthier. Now, ideally, you would have a Mediterranean diet that was a little bit limited in terms of portion on a temporal schedule, and that's when you get really, really healthy. But this is just a trick to use where you don't have to count calories. You don't have to count macronutrients. You don't have to worry about that. You don't have to think about it all the time. You just know I can start eating at 10 and I can't eat after 8, and that's all you have to think about. So it takes the mental effort and the psychological burden of all of this dieting away. So again, still being looked at. There's no consensus overall, but we do know that people get healthier. They lose waist circumference. They get less inflamed. They have less cognitive dysfunction. Everything seems to just get better on this.